Hi, I'm Dr. Arsenault, and today I'd like to talk to you about a common and important procedure called hysteroscopy. This minimally invasive procedure allows us to look inside the uterus with a camera to diagnose and treat various conditions. Let's walk through what you can expect before, during, and after a hysteroscopy. Hysteroscopy involves the use of a hysteroscope, a thin tube with a camera that is inserted through the vagina and cervix and into the uterus. The hysteroscope sends fluid into the uterus to distend it, which allows us to evaluate the uterine cavity and perform necessary treatments. This procedure can be performed under sedation, either in the office or in the operating room at the hospital, depending on the context. Before the procedure, you may be asked to avoid eating or drinking for several hours. We also may prescribe medication to help relax your cervix. It's important to follow these instructions to ensure the procedure goes smoothly. During the hysteroscopy, you'll be in a position similar to a pelvic exam. In most cases, a local anesthetic is used to numb the cervix in addition to intravenous sedation. Once we confirm that you are adequately sedated, the hysteroscope is carefully guided through the vagina and cervix into the uterus. The camera on the hysteroscope transmits images to a monitor, allowing us to examine the uterine lining and identify any abnormalities, such as polyps or fibroids. Common reasons for performing a hysteroscopy include investigating abnormal bleeding, removing polyps or fibroids, or removing an embedded intrauterine device or IUD. The procedure itself typically takes 30 minutes or less. After the procedure, you'll be monitored for a short period to ensure that there are no immediate complications. You'll go home the same day of the procedure. It's normal to experience some cramping and light bleeding after the procedure, ranging from a few to several days. Most people only require ibuprofen and Tylenol after this procedure. For the recovery process, we recommend taking it easy for the first 24 hours. You may still be drowsy after being sedated. Avoid driving within 24 hours of anesthesia. The only activity restriction after hysteroscopy is to avoid putting anything in the vagina for 1 to 2 weeks. This includes intercourse and tampons. Hysteroscopy is a valuable tool that can help diagnose and treat a range of uterine conditions with minimal discomfort and a quick recovery time. If you have any questions or concerns about the procedure, don't hesitate to ask us.